I'm Abigail Tumpy. I'm Associate Director of Communications for CDC Center for Surveillance, Epidemiology, and Laboratory Services. Welcome to our virtual career fair with CDC disease detectives. Now, in case you missed our virtual career fair yesterday with the Smithsonian, you can re-watch the event on the page below. Today, we are joined by 3 CDC disease detectives, Vikram, Jessica, and Kaylen. Kaylen, let's get started. Tell us a little bit about yourself and where you're from.
Hi, I'm Kaylen Potts. I'm originally from Kentucky, and I did a PhD in biochemistry and molecular biology. I did postdoc work in genomics, and I came to CDC about 2 years ago as a member of the Laboratory Leadership Service Program, and I'm in class of 2016, and I joined the Bacterial Meningitis Laboratory.
Thanks for joining us today, Kaylen. Jessica, tell us about yourself.
Hi, my name is Jessica Rico Lee. I am originally from Lima, Peru. I trained as a physician in Peru and then got a PhD in molecular pathology at UC San Diego. I had been working in research in infectious and tropical diseases, and I joined CDC 2 years ago also as a Laboratory Leadership Service Fellow. My main assignment is at the Streptococcus Laboratory at the National Center for Immunizations and Respiratory Diseases.
And Vikram, welcome. Tell us a little bit about yourself.
Hey everyone, my name is Vikram Krishnasamy, and I am from the great state of Ohio, where I was born and raised. I also went to medical school there before doing an internal medicine residency and then a preventive medicine fellowship. Then I ultimately came to CDC, where I joined the Epidemic Intelligence Service Fellowship, where I'm currently assigned to the Foodborne Outbreak Response and Prevention Branch.
Now, as Vikram mentioned, he is part of CDC's Epidemic Intelligence Service. Now, EIS officers are our elite disease detectives. They are our frontline defense, our boots on the ground during outbreaks. Now, Jessica and Kaylen are part of a sister program called the Laboratory Leadership Service. LLS fellows provide critical laboratory expertise in the middle of outbreaks, and the fellowship works to create leaders in laboratory science. So let's tell our audience a little bit about what made you interested in coming to CDC and doing a career in public health. Kaylen, do you want to start?
Sure. So I was the kind of kid that was always very interested in science, and particularly how science can impact human health. So when I started college, I had the opportunity to start working in a lab my very first year, and I loved it. I really enjoyed this idea of asking a biological question and then generating data so that you could answer that question. So I went straight from undergrad into grad school, where I studied the basic mechanisms of cell cycle regulation, and then I moved to gene expression regulation as a postdoc. And at the end of that, I really had a true basic science research foundation. And that work is very important for public health because it provides that foundational knowledge that you need to develop new medical advances and ultimately have public health policy. But it is very much at the foundation. And I found myself, after years in that field, kind of longing to get more to the cutting edge, where the work that I was doing was going to be impacting public health the next week or that very next year. So that's why when I heard about the LLS program, I thought, like, this is my break. This is my chance to transition to a career of public health. And I've really been able to use the program to develop my bench science skills and translate them into leadership opportunities around the laboratory. It's been a great experience.
Fascinating. So Jessica, tell us a little bit about what made you interested in coming to CDC.
So I have always been interested in infectious and tropical diseases. Training in Peru, I got to see a wide range of diseases that can affect humans in different populations. I have always liked to have a mix of clinical medicine, epidemiology, and laboratory. That's why my training then moved on to get a PhD in basic sciences. After that, I went back to Peru and I was working in the Peruvian Amazon. I was doing a mix of epi and lab methods, and it was very exciting. We were generating really interesting knowledge, but I wanted to do something that would allow me to improve people's health in a more immediate manner. So I was looking for my next step, and that's when I found the Laboratory Leadership Service Fellow. And I was really excited about the mix it had of broad set of skills and outbreak investigations, and also doing quality management and safety, and the opportunity to develop also all of these soft skills that come really in hand when you want to do a broader, more impactful job. So I have had a chance to do different things during my fellowship, also both in my lab and outside helping in emergency response. So it's been a great experience.
That's amazing. So Vikram, you happen to be a twin, is that correct?
That's correct.
And you went to medical school with your twin sister, but each of you took a very different route. So what made you come to CDC?
Yeah, you're right. I am a twin, and we indeed took very, very different routes. And I came to CDC after quite the training journey. So I started with an internal medicine residency that was focused in global health and underserved populations. And during my time there, I spent a significant time in Malawi, as well as working with the Navajo Nation in Chinle, Arizona, and volunteering in a free clinic on my Saturdays where I was available. And in that time, I became interested in understanding how do we prevent disease onset, especially for chronic diseases, in the people that I was seeing, and how do I do that on a larger scale? I felt like I needed more skills to do that after my internal medicine residency, so when I was tossing around what to do next, I decided to pursue a preventive medicine fellowship. Many people after internal medicine decide to do a cardiology or a pulmonary fellowship or an organ-specific subspecialty, but I decided to focus on public health and preventive medicine. And there, I worked with local and state and federal agencies over the 2 years and also got a master's of public health. And after that time, I felt like I had developed many, many more skills and some of the soft skills that you had referenced, but I still felt like something was missing. And so I ultimately came back to EIS to continue my public health work and also to develop further skills. And this has been a perfect or incredible opportunity to really do that.
Now, all of you have done really interesting outbreak responses. And Vikram, you said you were part of the foodborne team here at CDC. Could you talk about an example of an outbreak that you've done?
Yeah. By my assignment in the Epidemic Intelligence Service, I do focus on outbreaks, especially foodborne outbreaks. And I've done several, but one of the memorable ones, and one that comes to mind most quickly, is when I went to Utah in the summer of 2017. I remember I was at one of my friend's weddings in Canada, in Toronto, when I received a call from my boss and my colleagues saying, hey, we have an outbreak in Utah. We need someone to go out there to help with an investigation. Are you available? And that was a Friday. And on Saturday, I was on a plane back to the US. And on Monday, I was on a flight out to Utah to assist with the investigation. And it was an E. coli outbreak. And E. coli outbreaks can be particularly severe, especially in young children. And that was the case in this investigation and outbreak as well. But we were able to work collaboratively with an excellent team from both state and local health departments in Arizona and Utah, as well as the public health laboratories, and eventually identify risk factors that caused illness or contributed to illness and provide recommendations to the community to try and stop the outbreaks. And it was a fantastic example of how collaboration with a multidisciplinary team can really help investigate and solve outbreaks like that.
So Jessica, give us an example of an outbreak that you've done.
So I have actually been very lucky to be involved on outbreak investigations on two sides. At my main assignment, I use cutting-edge tools that compare DNA sequences of isolates to try to help understand whether an outbreak, which patients are part of the outbreak, which ones are not, just based on the DNA sequence, and that's something I do as my regular job. But also, shortly after I joined LLS, actually just a couple of weeks after we started, I got an email asking whether I was interested in helping with Zika response in Colombia. And I said, after 30 seconds, I responded, and I was like, yes, I'm on board. So I have been lucky enough to be deployed to Colombia 6 or 7 times.
Wow.
In 5 different cities. And I have helped set up a large cohort study looking at pregnant women, their babies, and some of their partners to try to see how infections during pregnancy can produce unfavorable outcomes later on and what these outcomes are. So it has been a very exciting experience. We have worked very closely with our partners in Colombia. We have trained a lot of field personnel, and we have had to deal with some logistical challenges of going and working in several different settings and starting up a study from the ground up. So it has been a fantastic experience.
That's amazing. Kaylen, tell us about an outbreak that stands out in your mind.
So I definitely had my big outbreak experience was related to an outbreak in Liberia of meningitis. So like we heard here, it always comes with that unexpected comment. So I came in on a Monday morning and my boss was there really early and she's like, come into my office right away. She sat me down and said, she's deploying with someone else to Liberia to do in-country testing for an outbreak, and I was gonna be the lead for the lab response in the Atlanta side. So there is that, very exciting component of it. But the outbreak was associated, or first identified as a cluster of unexplained illness. And it was actually only after specimens came to CDC and underwent a multi-pathogen screen or testing that Neisseria meningitidis, which is the bacteria that bacteria that can cause meningitis, was identified. So once that happened, that's when my lab and my whole branch activated. And as I mentioned, 2 lab scientists, including my boss, deployed, some epidemiologists deployed. But my role, again, back at headquarters was really to be a coordinator of the lab response. So I was constantly talking to the team that was deployed. I was getting their data back, helping them run analysis on it, actually helping integrate the lab data with the epidemiological data so that we could come up with our outbreak case definitions and really start to understand what was going on. So that was a wonderful experience. And honestly, before that, I had never really appreciated how much work is done in the background of outbreak responses, right? You always think about the people, boots on the ground, that are there, and of course that is an absolute critical component of the response, but there's also a ton of work being done, back at headquarters or back by teams, and it really gets at that multidisciplinary team comment that Vic made.
I think that's such a great point because you gave 2 examples of deployments, but also there's people here who are really making all of that work on the ground happen. Okay, so hands down, most memorable moment. Kaylen.
I would have to say mine was a deployment to Nigeria. So I was part of a lab capacity building mission. So this means that a laboratory invites us in and they ask us to train them on some assay because they want to develop a new method to be able to detect something. So I'm in bacterial meningitis, so of course they were interested in getting a PCR-based assay that lets them detect 3 of the most common bacterial meningitis pathogens. So that was an amazing experience because you get the opportunity to really share your expertise with people. And Nigeria is a country that has one of the highest burdens of meningitis, and particularly in recent years has had some really bad outbreak seasons, epidemic seasons, really. So it was really powerful to be able to go in there and help them with that. And it's funny, it was the first time in my life I've gotten on an airplane with more than 1 bag of luggage. So for the outbreak response, I went with a coworker, and I'm a pretty pack-light kind of person. I usually take 1 bag, but for this, between the 2 of us, we had these 6 massive boxes of lab supplies. And let me tell you, you get a lot of stares and a lot of questions as you go through customs with that much stuff. And it was funny, when we arrived, we actually had kind of a shared transport with a bunch of other deployers from multiple programs. And all of them, of course, are strutting through the airport with ease. And my friend and I are, pushing these massive carts. And they're like, how can you guys have so much stuff? And we're like, we're lab scientists. This is packing light. You don't know how much stuff it takes to build up an assay. So it was an amazing experience. I met a lot of wonderful people. And I would say that was my most memorable.
That's a great story. Jessica, what's your most memorable moment?
I think it shares a little bit with Kaylen. I think one of the most thrilling moments I've had has been the first time you walk into an airport at a foreign country and you have to go through customs and they ask you, what are you here for? And you're like, I'm here with CDC to give technical assistance. So that was exciting, but also after I had been in Colombia a few times and when we're actually going to start the study, the moment when you see that all of the plans that you had made on weekends and late at night, and you have dreamed all of these systems that you think are going to work, and actually seeing them start in trying to find little points in which you could improve, I thought that was very exciting.
Vikram, how about you?
Yeah, I think it's funny how all of our examples relate to flying and traveling and planes. So for me, my memorable experience, one of many, it comes down to an outbreak investigation in Hawaii. And I had just started EIS, it was August, it was my first week, and my boss sat me down and said, hey Vic, we have this outbreak in Hawaii, they've asked for some help from CDC, would you be available to go? And I said, yeah, of course, it's Hawaii. Why not? And at first, your gut answer is always yes, and then you think about it more and you say to yourself, am I equipped to do this? Do I have the knowledge to really do this? And the answer is you do. You come into this program with a very strong foundation, and you rapidly have to get comfortable with working in environments where you don't have all the information, but trust yourself that you will develop the knowledge to perform at a level that's adequate or exemplary for you and for everyone that you work with. And that's a highlight of doing EIS. And on a lighter note, while I was flying out to Hawaii, I was doing a little reading and trying to understand what may have caused the outbreak and what the investigation's findings were up to this point. There was some concern that it was linked to a sushi restaurant, and me being a vegetarian my whole life, I know very little about meat and seafood in general, and so I thought to myself, what am I getting myself into? And in foodborne outbreaks, it's really important to understand the cuisine that folks in the community are eating, and so I sat.
Or how it's prepared.
Yeah. And so I sat there on the flight reading the Wikipedia article on sushi, crosswalking it with the menu, trying to make sure that when I landed, I could sound like I knew what I was talking about when it came to the food items.
That's a great story. So what do you think makes your work so important at CDC? Vikram, you want to take this one?
Yeah, I think part of what makes your work great anywhere is how passionate you feel about it and the value that you can get from it. I think for me personally, when I've gone through this long training route, I've tried to figure out what do I want and what kind of work am I interested in, and through the training route, through the internal medicine residency, through the preventive medicine fellowship, and now EIS, I became very passionate about public health, and in doing so, I've developed a lot of new skills, especially here in EIS, and with those skills and the passion. And with CDC, it really brings everything together, because CDC is one of the lead public health agencies for the U.S. It's over 300 million people, and that inherently gives your work meaning. And to bring all of that together has been awesome. I've had an incredible 2 years, and I'd do it again in a heartbeat.
Jessica, how about you?
I think one of the things that struck me when I came here is the immediateness of results that the data you produce can have. And I had never had this before, otherwise than in clinical work. And so it's immediate and it affects broad populations. One example I have is we were working one afternoon with DNA sequences from a suspected outbreak. And some of the data were not as cut and dry. So we sat there and we were looking at this data, which is very dry, it's numbers. But depending on what we respond, there's going to be an outbreak investigation or not, this is going to affect people's lives. So that makes it very clear in my mind that you have to make the best effort to do the best possible job you can, because that is affecting people's lives. At the same time, with the work in Colombia, as we have been going on, there have been policies that have been started to develop based on early findings, based on the situation that we are assessing. So what we have found, what we have suggested, our partners have thought has been valuable information, and they have used it to implement policies that are countrywide. So I feel like our work affects people's life directly, and I think that's very, very important.
Yeah, so anything that you do is really affecting people on a very large scale. Kaylen, what are your thoughts?
So I've thought about this a lot. I think the best way to describe kind of what we do, because you get that question, right, from your family once you start working at CDC, yeah. What exactly is this about? But to me, I think the best way to think about it is CDC is all about generating good public health information. So, if you think back to a time in your life, like personal, professional, something like that, where you had to make a decision, but you had almost no context, no experience to make the choice. I don't know about you, but I've always felt extremely uncomfortable in those situations because I have no way to say if choice A or choice B is better. And CDC is all about generating data and information related to very big, important public health problems. So when people arise to a situation, an outbreak of a local health community, see something happening, CDC's service is that we provide some data or some information or context for them to make some of their choices. Now, as we all know, there may not be all the data you want, right? We all are always looking for more data. But I think that's really what makes CDC's work so powerful. It's getting all that information out there so people can make good decisions.
So some of our Facebook viewers today might actually be students who might be interested in being a disease detective. One sentence, what piece of advice would you give them? Kaylen, you want to start?
Sure. When it comes to your career, I feel like I think the best advice I've gotten is to be fearless. You know, I think my story is a good example. We've heard a couple here that, you know, I was really in a profession and fully trained to truly be a basic science researcher. And, you know, making the jump to public health is pretty scary. You know, I don't know exactly how my skills will translate. I don't know how I'll be able to adapt that. But if you hear about a job that you think sounds like so cool, I would love to be doing that, and you can convince yourself, I think I could be good at it, I think you should go for it. Be fearless, take that opportunity.
Jessica, what are your thoughts?
I fully agree with Kaylen, but I would also add, get a broad set of skills. Don't get too focused. And I found in deployment, being able to fix printers, being able to do all sorts of things are extremely useful and make you really valuable as part of a team. So don't get too specialized. Work on your soft skills. Get as many skills as you can, because that's going to be really helpful later on.
And Vikram?
For me, one of the things that came out of my training route was this idea of never stop learning. I think what you need to do is just a continuous self-assessment and trying to figure out what do I know, what do I not know, and how do I go about getting those skills to really help me be comfortable in the job that I want. And that's how I've approached it really over the last however many years it's been since I graduated from medical school.
Now, if you are interested in any of the jobs or the experiences you heard here today, you're in luck, because the application period for both of these programs is open right now. You can find details in the comment section below or go to cdc.gov/fellowships. Vikram, Jessica, Kaylen, thank you so much for being here today. And that's a wrap on our virtual career fair. Thank you so much.